Why is Medicare IEP enrollment through SSA so complex? Imagine trying to piece together a puzzle where some pieces are hidden, some are in the wrong place, and others change shape as you go. That's what enrolling in Medicare during the initial enrollment period through the Social Security Administration can feel like. The reason it gets so tricky is because of how the timing, rules, and administration work together. The initial enrollment period is a 7-month window that starts 3 months before your 65th birthday, includes your birthday month, and ends 3 months after. This window is different for everyone because it depends on your actual birth date, so knowing exactly when to act is key. If you miss it, you might face penalties or gaps in coverage. Medicare is run by the Centers for Medicare and Medicaid Services, but signing up is handled by the Social Security Administration. This split can cause confusion because you have to navigate to different systems. If you already get Social Security benefits, you're automatically enrolled in Medicare Part A and Part B when you turn 65. But if you don't, you need to actively apply during your IEP to get coverage started on time. This means understanding when to apply, how to do it, and what documents are needed. For example, you might need proof of your birth date, proof of employment, or health coverage details. Another challenge is understanding what happens if you delay enrollment. If you miss your IEP and don't qualify for a special enrollment period, you could face late enrollment penalties. These penalties can add extra costs to your monthly premiums. If you're still working past age 65 and have employer insurance, you need to coordinate your enrollment carefully. You don't want to end up with overlapping coverage or gaps. The paperwork involved can be overwhelming too, with forms to fill out and documents to submit, which can slow down the process. Timing is also a big factor. If you enroll in the first 3 months of your IEP, your Medicare coverage can start as early as the month you turn 65. But if you wait until later in the IEP, your coverage might not start until the month after you sign up. This can be confusing because your coverage start date depends on when during the IEP you enroll. Planning ahead and knowing these rules helps ensure you get coverage without delays or penalties. In short, the complexity of enrolling in Medicare through the Social Security Administration comes down to the timing of your enrollment, the division of responsibilities between agencies, the rules about late enrollment, and how your other health coverage fits in. Being aware of these details and acting within the right window can make the process smoother and help you avoid unnecessary costs or gaps in your health coverage.